tuning fork test. So this is the topic. So the questions are, what happens in the Weber's test? What is the inference? Next question, in case of the Schwabach's test, what are the findings? Then we look at the Gelli's test. So what are the findings of the Gelli's test? So we'll find out the answers in this video. So firstly, we look at the Rinne's test. So the Rinne's test, in case it is normal if the AC is greater than the BC. So if the AC is greater than BC, it is nothing but it is Rinne's positive. Next, if we look at the conductive loss. So in case of the conductive loss, the BC is greater than the AC. It is nothing but it is Rinne's negative. Next, we look at the sensory neural loss. So in case of the sensory neural loss, the AC is greater than the BC. It is nothing but the Rinne's positive. Next comes the Weber's test. So the Weber's test, it is normal. It is normal if it is central. And next we look at the conductive loss. So the conductive loss is nothing but it is lateralized to the affected ear. So it is lateralized to the affected ear. Then we look at the sensory neural loss. So the sensory neural loss, it is lateralized to the normal ear. So in case of the conductive loss, it is lateralized to the affected ear, whereas the Weber's test, in case of the sensory neural loss, it is lateralized to the normal ear. Next we look at the ABC, that is nothing but the absolute bone conduction. So absolute bone conduction is normal in case of normal ear, and it is normal as well in case of the conductive loss. Next, if we look at in case of the sensory neural loss, so in case of the sensory neural loss of the absolute bone conduction, so here it is reduced. Next we move on to the Schwabach's test. So in case of the Schwabach's test, it is normal. And then we move on to the conductive loss. So in case of the conductive loss, what we see is that it is lengthened. It is lengthened. Next, looking at the sensory neural loss, it is shortened. Then we move on to the Bing test. So Bing test is normal, and this is in the normal ear, it is normal. Next, looking at the conductive loss. So in case of conductive loss, the Bing test is negative. Then looking at the sensory neural loss and Bing test, this is nothing but it is positive. Next we move on to the Gelli's test. Gelli's test is, in case of the normal ear, it is positive. Next, looking at the conductive loss. In case of the conductive loss, it is negative, that is the ossicular lesions. Next, we move on to see the sensory neural loss. The sensory neural loss. In case of the sensory neural loss, the Gelli's test, it becomes positive. So now to answer our questions. The first question we asked is, what are the findings in case of the Weber's test? So in case of the Weber's test, it is in normal ear, it is towards the center. And in case of the conductive loss, so the conductive loss, it is lateralized. It is lateralized to the affected ear. Next, in case of the sensory neural loss. So in case of the sensory neural loss, it is lateralized to the normal ear. So conductive, it is lateralized to the affected ear. In case of it is a sensory neural loss, it is lateralized to the normal ear. Next we look at the Schwabach's test. So in case of the Schwabach's test, it is normal in case of the normal year, and in case of the conductive loss, it is nothing but lengthened. It is lengthened. Next, moving on, in case of the sensory neural loss, in SNL, it is shortened. Lastly, the question we asked was, what is Gelli's test? So in case of Gelli's test, it is normal. In normal year, it is positive. And in case of the conductive loss, it is nothing but negative as well as ossicular lesions. Then moving on to the Gelli's test in case of the sensory neural loss. So here, in case of the Gelli's test, in case of the sensory neural loss, here it is nothing but positive. The Gelli's test is positive in case of the SNL.